Okay, fine. Here is myself. This is Dr. Jawali. What Jawali? That means I'm a psychiatrist as well as a family physician in India, and basically, I'm an Australian doctor for the last 15 years, and also earlier to that, way back in 1990s, I was in UK, and if you have any issues regarding the healthcare crop or Medicare, see here I've got a Medicare online where I can try to help you out. Probably you can call me on my contact numbers or email me, for example. So thereby, let's see how we go from here. So if there are any issues, you can also log on to my you search for Dr. Arvind Jawali in Google. Probably go to Google site website, and you can hang out from there. You can search and contact me. But I would like to discuss on attention deficit disorder like ADHD and a little bit of other disorders like autism, which are not touched upon by many people, and the solution for that. However, other major psychiatric disorders are not very difficult, maybe managed over telephone. However, acute exacerbations may be controlled. Acute distortions may be controlled, but you need to go to hospital or emergency if necessary. If there are injuries, say for example, you need to attend. Of course, you will do that, hopefully, and more often than not, in metros, difficult to access the hospitals as a thing. But if you're in Australia now, you know very well how the services is. You can tell me, or you can just talk to the local number, which they will know now. Hopefully, that will be forwarded to them if you mail on to this number or consult your local hospital emergency. Even though there is shortage of doctors all over in countryside, uh, Australian towns and villages, countryside. Hopefully, you'll be able to access my website, as I said just now. If you're sitting somewhere in the corner or out back, you blokes get in touch with me, and of course you have an Alice Springs or something like in Northern Territory or say in Perth or the Western Australia, for example, you can contact me. I'm here to help you. Of course, it is just, I don't think anybody would like to disturb you. If you wish not to, okay. But however, you can send them an email or contact me on Skype. My Skype ID I will mail to you later. Okay, and once you're here with me, you can send an inquiry with my telephone number, which you can find out in the website of Google, this Hangout or whatever, this broadband broadcast, for example. You need to specify your requirements to me, and I will take it from there. All right, and what exactly you need to do is a follow up of your problems, maybe chronic disease problems, maybe you don't have a follow up appointment. Right? You have to wait for 2 years, 3 years sometimes. I know you blocks sitting there, and you can always contact me. I will organize for you some help to get rid of your problem, like surgeries or acute surgeries, chronic surgeries, for example. With acute, I can't. You need to go. Of course, that's a privilege of the continuum of care in the Medicare. You can take it there, the local hospitals. So you can fly with the RDS. I'll contact the people necessary to do so. Probably not necessary in case you are linked to an RD or RLDS. Fine. You coming back to India here because the Scenario is a bit different. Here I'm waiting for, there are 150 patients, 200 waiting online, but it's not an emergency, just a question and answer online. But I wish to have is a video conferencing that will create more insight into you people. Not necessarily anybody who is suffering with some sort of disorder, which is obstructing to the well-being, and it's infringing on the lifestyle. Well, here we are going to people, and we have to be proactive. Blood suddenly gets a headache. It's less common here in India. Of course, even if they may manage to live with that. The question is whether you're able to manage with the minimal pains, say, and the pain management is also very much in vogue. Pain management. Okay, there are a lot of things going on today. See, for sure, the side effects are many, but it can be sorted out. What pain is it? Like migraine, maybe joint pain. The pain which motivates the guy to go to hospital or doctor. More often than not, or it's sort of this like an uncomfortable feelings which take you to the hospital if you're panicking because this thing. It's what brings you to the hospital because of chest pain, making a confusional state of mind. Whether it's muscular pain or a heart pain, it's not heart, it's a muscle, of course, it's a cardiac pain. You need to figure out and start out this, because this is a lot of discussions over in Victoria, way back a couple of decades ago. This is what happens is you don't agree, many people do not agree that a person comes with the test, you don't have to worry about it, just pop in there like an aspirin initially and see that you're alive, and they make that you're alive, and you jump into some sort of vehicle supported or escorted major hospital nearby. Same thing holds good universally wherever. If it's a cardiac pain, but it's a heart attack, it may not be more often than not. It's misdiagnosed and mistreated, like unless otherwise seriously looked into for the accurate diagnosis. So same also is true with the snaps, like your tendon snaps, your bone snap, for example, and this can be handled very carefully. And if you look into it, you can just abort it immediately. And of course, you have to do an ultrasound or other investigation procedures available today. This can be done right in your town and take an opinion online with the telepsychiatric consults or telemedicine consults way. Okay, how it goes. But you don't have to wait. Like I've seen you guys waiting for 4 hours in the clinics, so where I conducted elsewhere, or in your town, okay, or in a city like Melbourne. This waiting is quite a bit longer. It takes 4 hours for this, it's really, or sometimes by appointment you land on the dot. This is what is important. If it's not well organized, you may catch cold from the guy and you fall sick as well. If it's a H1N1, you know what's it like. The patients, unless your ear curtain and also isolated and taken in and keep the air cleaner, otherwise the chances of cross infection. Same as in tram, you're traveling, or better that you use your own car than anybody else's, or just walk. That's the best way. Public transport systems, flying, all these things have the contagiousness for which you need to take preventive measures. Of course, I'll come back to that later when you come back. And if you have got any questions, please send it to me. Okay, I'll get back to you in an hour.